Hi friends, welcome to Origyn IVF. I am Dr. Rashmi Sharma. Today I am going to tell you about Endometrial Receptivity Array or ERA test. This is a test which a lot of patients come to us asking about it. So I thought maybe I should make a detailed video on it. So the test name suggests it is an Endometrial Receptivity Array. What it is? By doing this test, we are trying to find out an optimum window of implantation. So this test is usually recommended for patients who have multiple IVF failures, recurrent IVF failures. And how it is done, like in frozen embryo transfer cycle, from day 2, exactly same medicines are started as if you are undergoing a frozen embryo transfer. So those medicines are given for 10 days, 12 days, 14 days, and when we think the lining is ready, progesterone tablet is added, and on day 6 of the progesterone tablet, a simple endometrial biopsy is taken, which is done in the OPD on OPD basis, and that biopsy tissue is sent outside the country for testing. What are they testing? They are testing for a lot of genes. These are the genes, which is about 250 genes, which become activated when the embryo is implanting. So, you have to understand it in a manner like in a normal cycle, the uterus or the lining is not receptive to the embryo all the time. See, if we are putting in an embryo on day 6 of the cycle, obviously it will not implant, or day 30 of the cycle, obviously it will not implant. So the uterus or the lining is open to embryo only on certain days, which is known as window of implantation. Usually in a natural cycle, it is about 2 to 6 days after the ovulation, right? So in patients in whom IVFs have failed, like we have put in beautiful embryos and still the IVFs are failing, for those this test has been recommended. It tells us whether we should be transferring the embryo maybe one day late, maybe one day extra. So the report comes in 3 types. One is receptive. That means whatever you had done in your mock cycle, exactly same, we have to repeat at the time of actual frozen transfer. Sometimes the reports come as pre-receptive and sometimes it is post-receptive. So in a pre-receptive meaning, that means we have to transfer the embryo one day late. Post-receptive, that means we have to transfer the embryo one day early. Okay. So the big question is whether it should be done or not. It is a research test, and so as per the latest research, it is not recommended. There is a beautiful study in 2022 by Doyle et al. Which was a very beautiful study, double-blind, randomized control trial. So in this, what they did was, they had around 787 patients, and in all these patients, ERA test was sent in the prior cycle before the frozen transfer. Everyone had an ERA test, but not everybody's envelope was opened or not everybody's result was stored, right? And these embryos that were transferred in these women were genetically tested. That means they were genetically normal embryos, PGT-A normal euploid embryos. So in about 380 women, they opened the test envelope, and as per the test result, they went ahead with personalized embryo transfer. And in the other half, in about another 380 women, they did their test, but they did not see the result and went ahead with the embryo transfer in a standard manner without bothering about the test result, without even opening the test envelope. And guess what? The pregnancy rate in both these women was exactly same. In fact, in the group in which it was done personalized, after seeing the test result, it was about 58.5% live birth rate, and in the other one in which the test result was not seen, it was about 61.9%. So statistically, it was not significant. So this study told us that doing ERA test did not make a difference to the live birth rate or to the IVF success rate. This is number one. Also, the miscarriage rate was seen, and biochemical pregnancy rate was seen, and nothing was different. So that means ERA test is not really helpful. Another thing is that it's a very expensive test. It costs about 45 to 50,000. So doing such an expensive test, which also includes a little invasive thing, that means doing a biopsy, which is also like, I know it's an OPD procedure, but still it is some discomfort to the patient without any proven benefits. So it's really not recommended in today's time, and we have to see, we have yet to see a lot of more studies before actually recommending it. So in my practice, I usually discourage patients from going ahead with ERA until we have more evidence supporting it.